there are some diseases like hepatitis, hypertension, diabetes, obesity that are treatable but they are not curable. And most of these diseases are hereditary. When I say treatable, they are manageable for the lifetime and they are not curable. My name is Okafor Chioma. On today's episode on disease prevention, we are going to be talking about these diseases that are treatable and they are not curable, and how you can manage it so that you cannot get it, especially when they are hereditary. Now, what are hereditary diseases? These are the diseases that your parents pass down to you. When your parents have hypertension, diabetes, obesity, etc., you need to be careful when growing up. These diseases are easily transmittable from your parents. You are at risk, thereby you need to do anything you can do to prevent yourself from getting it. When you have these diseases, what do? You maintain them. They give you drugs, they give you therapy that will make you live a long time. When your parents have this disease, what should come through your mind is early prevention, because this is the only way you can prevent yourself from having it, especially hypertension. Hypertension goes from generation to generation, because when you get to a certain stage, that is when you start seeing it manifesting. Same thing with diabetes. The funny thing is that most kids now have kidney failure, diabetes, and you'll be wondering, what have these kids eaten to the point that they now have diabetes at this early stage? This is because their parents gave it to them. The only thing you can do to prevent yourself from getting them is by early detection. First of all, you have to be going for checkups all the time to prevent yourself from getting these diseases. Secondly, you live a lifestyle that will not cause you to have this disease. Take for instance that your parents are obese. What do? You have to be on alert. You don't have to do anything that will make you fat. You have to avoid food like carbohydrates. You have to avoid cholesterol so that you don't become obese like your parents. This is early management. Your lifestyle, what you eat, your exercise, depending on the type of illness we are talking about. Meaning, whenever your parents have this illness, don't overlook it. A lot of us in Nigeria think that when my parents have hypertension, it means they only have it. When they have rheumatism, you think they are the only ones that have it. No. You have to start early to prevent yourself from getting it, because most of these diseases will wait for you to get to a starting stage and you still pick it up like your parents. So your lifestyle and what you eat makes up your health. I know a family that are hypertensive, but due to the fact that they eat a lot of sugar, a lot of salt, they were told by the doctor to reduce hand in the amount of salt they eat. It's not like they have this hypertension, but you know that when they get to a certain stage in life, they will be able to pick it up from their parents. But this can help you to reverse this instead of picking it up from your parents. Please, I'll highlight them again. Make sure you go for early checkup, which will help in early detection. Make sure you live a very healthy lifestyle, and make sure you identify the illnesses that your parents have that can be transferred to you, and you start working on them early. Do things that you can do. If it's exercise, if it's avoiding a certain type of food to make you live healthy. Remember, your health is your wealth, and it's better you prevent disease before you get them. My work here is to help us to reduce disease to its minimal level and prevent diseases. That is what I came here to do. Thank you so much for listening. I still remain your girl, Choma Natasha. I bring to you health tips for us to live healthy lifestyle. Remember, prevention is better than cure. Be fit, be healthy. Follow us on our social media platform. Please make sure you subscribe to my YouTube channel, Choma Natasha, Twitter, Facebook, Instagram, and whatnot. Please, whatever you want us to talk about, please comment in the comment section. I'll be there to see your comments. Thank you so much, and thank you for listening.